or 3 years or a year. These vaccines have already been administered in Great Britain and Canada. They're now going to be administered here in the United States. And this is a really, really significant milestone in terms of combating the coronavirus pandemic. I know that as we get into the end of this week, I've spoken with the FDA Commissioner, Stephen Hahn. They're going to do the same thing with the Moderna approval that they did with the Pfizer approval. So Moderna, the advisory committee will meet on Thursday to discuss the issues with Moderna. We anticipate a favorable recommendation for that. And then FDA will work hopefully through the night to be able to get the EUA issued on Friday of this week. And then we're in the same schedule that we had with Pfizer. The shipments will be arranged. We'll start receiving those hopefully Sunday, Monday, Tuesday of the following week. That's going to be in Florida a little less than 400,000 we anticipate. I think about 365,000 of Moderna, which is a significant amount. That is going to continue to help serve our long-term care mission, but also start, hopefully, as kind of the frontline healthcare workers have this available, to start getting it out to some of the elderly population outside of long-term care facilities. And then certainly by the third week of December, when we get even more Moderna, we hope to be able to really start to offer that. And then in January, if the supplies keep coming, we want as many elderly to be able to get it as possible. Now, the one thing we're waiting on, in the initial plan for the Pfizer, we were going to get 179,000 this week. But then we were going to get several 100,000 each the next 2 weeks of the Pfizer. Right now, we don't know. They have kind of dialed it back. I think they're working through some production issues. So we anticipate the Moderna coming at the beginning of next week, between 300 and 400,000 doses. We're hoping that the Pfizer order is fulfilled for the next 2 weeks beyond what we're getting today and tomorrow. If we get all of that as scheduled, then that's probably more than 1 million doses. If we don't get the remaining Pfizer, then we're looking at probably 700 to 750,000 for the month of December. Either way, it's going to make an impact, but obviously we want to see as much of this rolling off the assembly line and getting into hospitals as we can in terms of this. We were able to see how they're storing it. They have the capability of storing an awful lot of vaccine, far more than they got today. They can store a lot of these vials, and so as this stuff becomes more widely available on Pfizer, this is obviously a place we know that can handle it. The good thing about the Moderna, it doesn't require quite as extraordinary of storage. And then the J&J vaccine, which we hope will happen in the new year, either January or February, that is just basic refrigeration, and it's one dose. So the vaccines that were delivered today, for every vaccine that hits, there's a corresponding booster that is being withheld. They didn't want to send it all, I think smartly, because you don't want to just keep 200,000 vaccines and tell someone they can't get it. So you're going to use that, and then when it's time for the booster, 21 days, those other shots will come, and that they can be given the booster shot for this. So this is a game changer. It's a great day for the United States. It's a great day for the state of Florida. I'm really glad that we were here in Tampa General to do it. Of course, we continue to work with them across a variety of issues. We think these monoclonal antibodies have been very effective. It's going to take a little while to get the hard data on it. As it stands now, between November 1st and December 12th, Florida was 43rd in per capita cases, so 42 states had higher per capita caseloads. Between December 6th and 12th, we were 46 per capita. Again, 45 states with higher loads. And then hospitalized patients as of December 13th, the last date we have full nationwide data, Florida was 43rd per capita for COVID-positive patients being treated in Florida hospitals. So again, 42 states with higher loads than us. So we think that we're getting this at a good time. We think if we get it to the right folks who are the more likely to be hospitalized, that we can continue to keep those numbers in line. So I just want to thank everyone for all their hard work. This has been something that we've been working on for weeks and weeks. As soon as the Pfizer news came out, I flew to D.C. I met with as many key players as I could. We're in contact on a daily basis with Operation Warp Speed, and so far things have gone very well. It's a very significant logistical challenge for the federal government. And so far things have gone well, and I know once it gets in the hands of Tampa General, they're going to continue to do a really good job. So today, we will have shots going in arms. We will have healthcare workers getting vaccinated much sooner than anybody would have anticipated just 6 months ago. God bless America. I'd like to introduce John Corus now.
Thank you, Governor. On behalf of Tampa General Hospital and the entire team, I want to thank the Governor and the entire state, legislature, the leaders, the staff. What you may not realize is that through the Governor's leadership, the state has been with us every single step of the way from the very beginning of this pandemic. Not just Tampa General, but all of the hospitals in this great state. I'd also like to thank the federal government, because this morning at about 10 o'clock in the morning, we received the Federal Express packages, and the FedEx truck pulled right up like it would normally do, and it had a delivery time at 10:30, and it came 30 minutes early. It came in at 10 o'clock. To have that kind of logistical precision happen across this country is absolutely outstanding. And when you're on the front lines, when you're caring for patients, when you're managing an organization through something like this, to have the type of leadership and cooperation at the state and federal level is critically important. So thank you, Governor, for your leadership and your entire team's efforts. The next thing I'd like to comment on is that this is truly a historic moment. I mean, just think about it. Less than a year ago, we were confronted with this awful pandemic. Today we're sitting here introducing right now about 20,000 doses of the Pfizer vaccine. And the way I've described it to my team is this is 20,000 doses of hope. This is the beginning to the end. This is monumental if you're sitting in our shoes caring for the patients that need us the most. Finally, this is game time. We're ready. As the Governor said, Tampa General Hospital has the resources, has the staff, has the supplies, now has the vaccine. We are ready, and it is absolutely game time. And we will not let down this community. We will not let down our team. And we're honored to be one of the hospitals leading this effort. Thank you very much. And now I'd like to introduce Jared Moskowitz, the Director of Emergency Management. And the way I would describe Jared, and I've used this a few times with other people, if I was in a foxhole, I'd want Jared right next to me in that foxhole. This guy is steady under pressure and has done an incredible job with his team to help us navigate through all of the complexities that we were confronted with for almost a year. And with that, Jared, come on up.
Okay, no pressure now. John, thank you. Governor, thank you. It really is a miracle to be here today to helping administer vaccines less than a year of dealing with this pandemic. It is a tribute to the frontline healthcare workers who are going to be the first recipients of the vaccine, the heroes that have been on the front lines dealing with this every single day. It's a bittersweet moment for families who have lost loved ones to the pandemic, or families who have had folks in hospitals and have not been able to visit them. And it really has been a collective team effort. I want to obviously thank Tampa General. I want to thank the other 4 hospitals that are ready to go to help distribute this vaccine. We really, at the Division of Emergency Management and our partners at the Department of Health, have been aggressive since day one. When we couldn't find COVID test kits, we went out in the private market and found them. When there was a national shortage on swabs, we went out and we found them nationally, internationally. When PPE became the issue, we did everything we could to make sure that our doctors and nurses had the PPE that they needed, that our folks in the long-term care facilities had the PPE they needed. Over 80 million masks have been distributed from the Division of Emergency Management. And so, while this is not the end, We have a long way to go. Obviously, it's going to take a little bit to get this out. We will continue to be aggressive. Folks continue to do mitigation measures as we, get through this. But, we're hoping at the division that as that supply comes, you will see a significant, robust effort between ourselves and the hospitals and the local partners at our counties. I know my staff, the staff at the Department of Health, this is a big day for them. This is a big day for every emergency manager at the local level, at the state level, every Surgeon General in the country. Everything we have worked for since March has been building to this moment. And so thank you, Governor. Thank you, John, for having us here today. And we continue to look forward to the partnership with Tampa General.
Well, I will be very brief. I also want to thank the governor. It's hard to describe when you're kind of at that darkest moment of the pandemic back in March and April and May, what a relief it was when we would need anything. You seem to be able to deliver it. PPE was one, remdesivir, then the monoclonal antibodies that have made a huge difference. Now the vaccine, we're incredibly grateful. Obviously, USF and Tampa General are a team, and John, you have also been extraordinary, and we're very grateful for that. This is a magic moment. I was trying to recall something equivalent, and I thought back to when I was a kid and Neil Armstrong walked on the moon. And from a healthcare perspective, this is our magic Neil Armstrong moment. So this hopefully is the beginning of the end of this terrible pandemic. I would not be the dean of the medical school if I didn't tell everyone to we're in the fourth quarter. We're in the last few minutes of the fourth quarter. We have Brady as our quarterback. Please keep wearing a mask, socially distancing, avoid large gatherings when people aren't doing that. It is incredibly important. We're almost there. But this Herculean effort is going to really make a huge difference, and we will have a return to normality very quickly. And I think Dr. Kim is going to speak briefly.
Thank you very much. I'm really, really honored and excited to be here. Thank you to the governor, Mr. Corris, Mr. Moskowitz, Dean Lockwood, and truly, this is a thrilling day. We're very proud of our teamwork here. And this vaccine coming out is a real triumph of science and teamwork and what the best minds can do. And I was one of those supposed experts that was hopeful but a little skeptical 6 months ago, and I'm so delighted to be proven wrong. And I think that all of us should, as Dean Lockwood said, hang in there, continue to do everything that we can to protect our families and our communities, and work with all of us here in the healthcare field to help our communities and get out of this terrible pandemic. But anyhow, it's a very exciting day, and a vaccine that's 95% efficacious in such a short time is truly a miracle of science. Thank you very much.
And so today we are obviously going to start with the healthcare, frontline healthcare workers. And some people ask why, because most of the people that work here in that, they're not necessarily high risk from a health perspective. It's more high risk because you're in contact a lot. But part of the reason, quite frankly, is hospital bed capacity has never been an issue in spite of initial models saying that America was going to run out. But what happens is if you have an exposure, you have an infection, and you have to have 10 staff isolate, that is very difficult in terms of these operations, not just for COVID, for anything. So part of it is health. Obviously, we want everyone to be protected, but part of it is getting these key workers vaccinated. You're going to ensure that health care is going to be able to be delivered uninterrupted, not just for COVID, but for many other things which are very, very pressing. So we look forward to doing that. And I would just tell the general public, the healthcare workers there's a certain finite amount who would qualify and who are going to want to take it. Obviously, we have a certain number we have more long-term care facilities here than most other states, of course. That's a finite number, and obviously many will take it, not everyone. And so then we really are going to start focusing on the most at-risk folks in the general population, our seniors, our elderly, folks that have really serious, usually 2 or more comorbidities. And so that's when we get beyond the healthcare phase, when we get through the long-term care, that's really where you're going to see a lot of the emphasis. Now, if you're just general public, not necessarily high risk, but maybe you'd want to do it, I think where we're going to be seeing that is once the Johnson & Johnson data is in, we'll see how effective that is. If effective and safe, they will file for emergency use authorization probably in January, and so we could potentially see an approval for J&J. That is 1 dose. There's a lot of it that's been produced. So as we get into that, if that does happen, and of course there's going to be more Moderna and Pfizer, which require the 2 doses, but as we get into potentially February, you could be in a situation where there's going to be vaccine for people regardless of circumstances or health risks or age. Probably not before that, and maybe not quite at that point, but that is very possible. So we're just going to keep communicating and let folks know kind of what we're doing. But if you look at how the virus has affected different populations, clearly it's had a much more negative impact on folks who are very elderly than people who are very young. So we're trying to prioritize the folks that it can make the most impact for. And we're going to continue to stay on it. We're in this. We're going to be working with John. We're working with all these other healthcare systems. They've really done a great job for the state of Florida. They've worked collaboratively long before the vaccine on a whole host of other issues. And that wasn't always the case, I think, normally because they're competitors. But they understood this is an important time. They've done a great job. And so we're happy to be here today. And look, talk is cheap. Yeah, we saw FedEx deliver it. We're saying how great it is. But let's actually get some shots in arms. And I'm happy to say that you're going to see the first shot done right here, right now. So you guys ready to go? So we're going to come. And this is, I guess, patient 0 for the state of Florida as it comes to vaccine. So we have Rafael Martinez will be administering the vaccine to Vanessa Arroyo. Vanessa is a frontline nurse in our brand new Tenacia Family Global Emerging Disease Institute, which is their COVID unit. She's 31 years old, has been working at Tampa General for 8 years, so we appreciate all her hard work. Thanks for being willing to step up and be the first patient, and this is exciting. So can you, yeah. Can you just explain what you're doing? I can do it over the mic, but you're just this basic shot. Is there anything special for this vaccine compared to other things you would administer?
Just like the flu vaccine.
Yep. Okay. Yeah, absolutely. Yay.
And then we ask the patient, benefit? No, that's it.
Piece of cake. All right. Thanks, everybody. Appreciate it. Thank you. Appreciate all your hard work. All right.